We're talking about 600% more oxygen dissolved in the plasma after the hyperbaric chamber, 600%. So now we all know that oxygen can help all those cells reproduce and fill in faster.
When your horse gets injured, the path is predictable. Call the vet, follow the textbook treatment, hope for the best. But what if the future of healing isn't in prescriptions or routine protocols, but in something far more powerful? For decades, regenerative therapies like stem cells, ozone therapy, and PRP have transformed human medicine. Yet, in the horse world, they've been met with resistance, skepticism, and industry pushback. Dr. Alberto Rullan knows this fight firsthand. After witnessing his brother survive cancer thanks to experimental stem cell therapy, he made it his mission to bring these life-changing treatments to equine care. And the results? Nothing short of revolutionary. So why aren't these therapies mainstream? And what could they mean for your horse's future? Stay with us, because today we're sharing what's possible when we break free from outdated systems and demand better for our horses.
Dear Horse World, it's Dr. Alberto Rullan.
Alberto, welcome to the Dear Horse World podcast.
Thank you. I'm extremely excited to be here with you, Noelle.
I'm really excited because before we started recording, you said something that always gets me really excited.
Yeah?
You said, let's stir things up.
Absolutely. That's my specialty. Stirring things up, bringing it on, revolutionizing.
So I'm going to read something from your regenerative therapies book. And I thought that would kind of kick us off.
Okay.
Because it really, it perked my ears when I read it.
Got it.
Innovative equine regenerative therapies are the need of the hour to save horses from getting overloaded with pharmaceutical agents. There are so many reasons to adopt such therapies. It is actually the ethical responsibility of clinicians to not only treat patients with strong dosages of drugs, but to find innovative solutions which are less harmful and more safe for the whole body. Many times, due to a lack of availability of the latest therapies, patients couldn't be saved, kept alive. This is of great concern.
Amen. Sounds like I wrote that. Yeah.
Okay. What made you want to write that?
Yeah. Let me give you a little background on my story. Everything I do has some sort of backstory of where I have learned it. And it's usually because some sort of not traumatic event, but extremely traumatic event, usually. So this particular one dates back to when I graduated veterinary school. All my life, I grew up with my brother William, and we were inseparable. So when I went to vet school, he was still back in Puerto Rico, and he used to come with me on the summers and train for the end goal to open a clinic together. So when we moved to Florida, that we were reaching our goal, we were hitting wall after wall because it was in 2007. And if you and the audience remember, in 2008, everything started collapsing in the equine world.
Economic crisis,
My main focus was lameness and laminitis, and we couldn't treat patients because most of them were unfortunately be put to sleep.
Well,
back in those days. Then my brother and I started, we started our endeavor in treating lameness and laminitis. However, my brother one day got kicked by a horse. And that kick, we get kicked by a horse commonly, right? So we didn't think much of it. However, he started showing some strange symptoms. And his leg kept getting blacker rather than better, and then started to get yellow. We didn't think much of it. So he kept working just like any horse person. Take some ibuprofen,
Yeah.
and that's it. Went to the doctor said, here's some more pills, and kept going. Several days later or weeks later, he's still feeling sick. He's starting now to cough, and he's starting now to have nasal discharge. So went to the doctor again, and the doctor gave him steroids. Then he went back home. Now he's in steroids plus some antibiotics, plus some more drugs and a pile of medicines,
like
right?
pain medication.
Yes. Several weeks later or days later now, he's starting to get very tired. And we're like, okay, let's go to the emergency room. They started doing blood, and it happens that his blood cells, his red blood cells, were dropping like crazy, and he needed an emergency transfusion. Out of the blue, he needed now a emergency blood transfusion. Then after that, they started doing tests. No one could find out what was wrong with my brother. And he was 22 at the moment. And I never forget this day at the hospital in the elevator. The doctor came and stopped us and says, hey, we know now that your brother had leukemia. So, yeah. So he was then diagnosed with leukemia at that moment. I just couldn't believe it, right? And she left it up to me to go tell him that he had leukemia, and the word came up to a halt, to an end, however you want to call it at the moment. I was, at the moment, I was with my mom. The next 100 days, we spent it at the hospital thinking that my brother was going to die. However, several weeks later, another doctor came in, which, by the way, I requested an immediate transfer from that hospital because I didn't like the approach, right?
Yeah.
So we requested transfer to another hospital, and another doctor came, hey, your brother qualified for an experimental study with stem cells. And right there, we were all in.
Yeah.
We were like, we didn't even think about it.
Yeah.
Because now we have some hope.
Yeah.
And several weeks later, several months later, he was cancer free.
What?
Yeah. And we started working again, and we built a practice. And based on that story and this experience, we're like, okay, so now we're going to use alternative therapies such as regenerative therapies and stem cells and others to treat our patients. We want to ensure that our patients get the most out of this. Now, let me tell you, before that, stem cells used to be a taboo. The stem cells were not well accepted.
And why is that?
Back in the days, they used to think they came from, I think that they used to think that we had to kill babies to get stem cells. There was a big controversy with stem cell research and where they were coming from.
Well, and we live in a world of a lot of information and a lot of misinformation.
Correct. So as a veterinarian, when I was in school, I knew about stem cells, and we were using a lot of stem cells with great success. But in the human, it was not that well accepted yet. And when we got into this experimental study and they worked so well, then after that, we pretty much based our practice on alternative and regenerative therapies. It was clear that he was getting drug after drug after drug rather than getting a proper diagnosis.
Right.
So we base our practice on diagnosing, figuring out what's going on with the problem or what the problem is, and then treating our patients. And yes, we do still practice a lot of what we call Western medicine, because a lot of clients are still having resistance these days with regenerative. But we still educate. That's why we wrote this book on the regenerative medicines available.
So you find that you're often treating horses in traditional ways because the owner
100%.
has, let's say, like a resistant mindset to what you're offering.
Yeah, 100%. Not just the owner, the veterinarian of those horses. A lot of times horses can come to us in a rehab center referred by other veterinarians, or they have other veterinarians behind those horses, right?
Yeah.
So and they are extremely against alternative therapies or regenerative therapy sometimes.
Well, and it's interesting you mentioned stem cell, because I actually had stem cell treatment on my knee when I tore my ACL. And I had two experiences. My first time I tore my ACL, I had a high-grade tear, and I went and had ACL surgery, which is the traditional one where they take a graft. In my case, they took a graft from my hamstring, and then they used that to replace. And it was like full on, like full surgery, and it was the traditional approach.
Yes.
And I went to one of the best in my city in Vancouver, and he did a lot of work on a lot of the Olympic athletes for the Canadian team. So I went to the best. But the reaction I had to the opioids that they gave me, it really affected my immune system and my overall health. And I had terrible muscle atrophy. So when I did it again, and I had a second ACL tear, which is really common. And I did a lot of I did a lot of skiing. So
Skiing.
yeah. So I did a second high-grade tear when I was skiing, and I remember at the time being like, there's no way I'm going back and doing that again. There's no way that I would put my body through that. So I started doing some research, and I found stem cell therapy in Broomfield, Colorado. It's called Regenerative Clinic, and it's like one of the forefronts of stem cell treatment for high-grade muscle tissue tears like that, ligament tears. I was blown away by the difference so not only did I have equal or better than results in the healing process, but I was back physically, physically able to use my body, physically able to bike, to ride, to ski, not to ski because it was out of season, but I was able to do all the physical things that I wanted to. And I didn't have any of the after effects or the what I would call the side effects of the treatment. It was so much less invasive.
Yeah.
And so I can't help but think that that's also the case for our horses.
100%. And some of the great things that we have discovered is that not just stem cells, but other regenerative therapies or alternative therapies like PRP, alpha 2M, ozone, and oxygen hyperbaric chamber.
Yes.
All these things, which why do we include them in this topic? It's because they improve the natural healing of the body. So they are a great combination with surgery, for example. Many times we have horses that come with fractures.
Yeah.
And these horses need either a bone chip removed or need screws and plates to repair a fracture, just like a person. But what we have discovered is that when we actually implement alternative and regenerative medicine with these combined with these surgeries, the recovery, just like you say, is better, is faster, and the return to athletic performance is way faster than the traditional approaches. What was the traditional approach? Wait and see what happened.
Totally.
Wait and see what happened. But I'm always just so intrigued. Why waiting and see what happened when we can actually prevent? So I am one of those in our industry. It's very common. They teach us in vet school. Wait and see what happened. Great, but check this out. If you have a problem, you have a fracture, you have a ligament tear, and you wait and see what happened, by the time you wait and saw that it didn't go right, you have scar.
Yeah.
You have decreased range of motion.
Yes.
You have decreasing cartilage
Yeah.
thickness, or you have degeneration.
Yeah.
And then now you waited, see what happened, and then now either you cannot fix it, or it's going to be a lot more expensive to fix, or the prognosis is not going to be as good. So why not use early treatment to prevent something that you know is going to happen? So that's kind of our approach on using the regenerative and alternative therapies.
So let's dive into some of the specifics, because now since I've met you, my horses are using some of these therapies, and I've been really excited and also surprised that when I speak to different vet techs that I've known for a long time, for example, ozone therapy, I'd never heard of it before.
Yeah.
I have different people even who've worked for me that worked in the veterinary science field, never heard of ozone therapy.
In the United States, this is a taboo. Just like stem cells used to be a taboo. Why is it a taboo? Well, have you ever think who are the biggest lobbyists in the Congress
Yeah, in
spending.
in this political system in the United States.
Who are the biggest? Where's the biggest money coming from? Do you know?
Pharmaceuticals.
Pharmaceuticals,
Mm-hmm.
right? So
And not just human, but I mean, the animal pharmaceutical
absolutely,
industry is
it's all related.
humongous.
Yeah, it's all related.
Yeah.
When I went to vet school, I paid for very little lunch. Most of my lunch were paid by pharmaceutical companies.
Your lunch?
Our lunches for everybody, they go to the schools
Wow.
and they pay for our lunches, right? But on the education, they give us education. Say, hey, come listen to this talk
Yeah.
and we'll pay you lunch.
But you think that influences the minds of veterinarians early on?
Well, let me ask you a question. Now you are a middle class to low class woman
Yeah.
or man. You are 22. You just got a loan for $300,000
For your degree.
for your degree.
Your education.
Yes. And you have to quit your job because now you have to be a full-time student.
Yeah.
Or you have a job that pays you 12. In my case, when I went to school, it was $11 an hour.
Mm-hmm.
And someone tells you that's going to pay for your lunch.
Yeah.
What?
I mean,
Where you want to save, wherever you want to save, right?
of course, yeah.
So now, but check this out. Check this out how cool it goes. Because it is a good thing to provide the education. What they're doing is providing the education to the client, to their future client, which is the vet.
Yeah.
And this time the student who is in distress because of the schools and everything has to go. So they're making it easy.
Yeah.
Hey, don't go out to buy lunch.
Yeah.
Get your lunch here.
Yeah.
We'll just pay for it. Just listen to this talk because this is a drug that you will use in the future,
Mm-hmm.
that we have done some research on it, and it's FDA approved, which means that 51% of the patients show a little improvement. So is
that what's required for
Yeah, right.
FDA approval?
Yeah.
51%.
Yeah. So they got approved by the FDA, and then now we have an audience that is a potential candidate to use that when they graduate from vet school.
Mm-hmm.
So
And how long are you in vet school for?
You're in vet school, you're 4 years.
Yeah.
But before that, you spend 4 years in college.
Because I'm thinking that's 4 years of familiarization. That's 4 years of getting really familiar with a company, a beautiful company.
It's genius.
Yeah, it is genius.
It is genius. So we never thought of this, and I don't know if anyone have ever thought about this. It's just
I've never heard people talk about it.
I don't think anyone has. I just thought about it because when I started coming out and using these technologies, the first people that were against it were veterinarians. And I said, why would they be against something that causes no harm,
That works
better
in some cases,
that works, that has no side effects?
Yeah.
Why would you be against it? And then I kept going. I really couldn't fathom it. And then I realized, wait a minute. It's actually the great marketing that they do. I mean, our blood cannot just go and do marketing. You cannot.
Yeah.
You know what I'm saying? Our blood has very low marketing skills.
It's true.
Oxygen has very marketing skills.
Yes, it's true.
Ozone has very low marketing skills or money, or they don't have any money to market.
Well, because you can also individually empower the person. Right? Because a lot of people, since learning about ozone, I've learned so much about this whole subsect of people who are utilizing, and many people of which I won't mention in this podcast because I don't have their permission.
No.
But people at all levels of the equestrian industry use ozone on their horses and on themselves.
Yeah.
And I was blown away.
Great.
It was like finding out about, I don't know, Easter bunny, something almost not mythical, but just like something that was present,
hidden.
Yeah.
It's hidden because let me tell you a very interesting story. When I first started doing this, a client came to me with very desperate, and she wanted answers, and she wanted the horse fix. And pay attention to this story, because this horse was sick for a very long time. It has a respiratory disease for a very, very long time. And she went to a hospital here in town. And then she came to us looking for an alternative. And we actually did stem cells on that horse in the lungs. Back in the days, that was never heard of.
Wow.
And we told the client, this is actually experimental.
Okay.
We told her,
Yeah.
and she signed and she agreed, right?
Yeah. Yeah.
Great. Then several years later, I found out, because she tried to put a complaint on us, that the horse did not get cured. That's it. That was a complaint. The horse did not get cured. And she put a big fit. Big fit. She even went to the board, the Florida State Board, because I did an experimental study in her horse with stem cells. But she agreed to be in that experimental study.
Yeah.
But what prompted her to put the complaint and try to fill out a lawsuit that never passed any attorney? That when she went back to her vet, her original hospital here in town, she's one of the most known at that time, they told her that the horse was not cured. But check this out.
Yeah.
But when the records came out, because they have to disclose records,
Yes.
the doctor's medical records say the horse had actually improved.
Wow.
However, they say a non-FDA approved procedure was done by me.
Yeah. Yeah.
And the horse didn't get cured, but the medical records,
But the horse did improve.
the horse did improve. So,
And it had not improved 4 years prior.
4 years prior.
Mm.
But how interesting is that?
But it makes me think that often, when we disrupt the status quo,
Yeah.
often I find, and the horse world is no exception to this behavior, but humans are often, it's met with resistance always first.
Yeah.
Right? First suspicion, first resistance. And maybe we've been trained that way. Maybe it's in our biology. But there's always this feeling of, no, this can't be. It can't be that. It can't be not that easy, but it can't be. This can't be the solution.
It's a huge disbelief. And I think that you're right. Anybody that has come up with something new is going to be seen kind of crazy, if you will, right? Crazy, disruptive. And I read on, like you said, I don't know what it is. Maybe it's another biology.
Well, and I had breakfast with one of our masterclass instructors. Her name is Max Corcoran. She's a top level groom. Many people listening to this podcast will know who she is. She's a highly respected horse care and horse management advocate at the Olympic level. And I said to her, sometimes I wonder that as a community, as a subculture, as the horse world, because we're so used to working so hard for everything, we work. I would say as a people, we work 10 times harder than many to just develop an outcome, not even necessarily a better outcome, but just an outcome. So I think we're trained at a very young age to work really hard to get a result. And I said, I wonder sometimes whether our limiting belief as a community is that everything has to be hard work.
Oh, you just touched on something very powerful. A limiting belief. Yeah. Our limiting belief could have been ingrained in our brain since...
And trained, right? Because so much of horses is hard work. Like to have a horse is much harder work than having a dog. To have a horse is much harder than not having a horse, right? So even from a very young age, we're taught, okay, we have to work from sundown to sunup. Like, you ever talk to a horse person and say, oh, do you work 9 to 5? And they'll laugh at you, right? Because it's just, you're working longer hours, you're working 6 days a week, you have less time off, and you're also being met with a ton of disappointment, you're met with a ton of unexpected outcomes. So I wonder sometimes as a collective, culturally, do we have this fundamental belief that, if we want a really good outcome, it's going to be through a lot of hard work. That there's no such thing as a simple answer.
That's a great point. I love that point. I really resonate with that point a lot. And I resonate with that point myself personally. Sometimes I find myself working harder than I need to in order to do some things. Absolutely. I never thought about it, but you're 100% right.
So what is ozone therapy?
Back to the ozone. Another thing that I wanted to tell you is ozone is not an FDA approved therapy. Okay.
Okay.
Very important to know. Ozone is not an FDA approved therapy. So it's almost like when I first started doing it, almost feels like you're doing something illegal.
Whoa.
It really does. Because in the United States, what you do is anything that is not FDA approved comes with, oh, you're doing something that is not approved, right? So that sounds like, is that illegal?
Yeah, that's a language piece that's very important there.
Yes. And I got very informed on this very early on because of that. So I spent a lot of money on attorneys figuring out, okay, how can I do this and ensure that I'm covering my bases because I'm bringing a therapy that works, that has no side effects. How could this be illegal? And I think
also many of us don't actually understand the protocols. I certainly don't understand the protocols of what it takes to get something approved by the FDA.
absolutely 100%.
So we use it as a measure of efficacy, or we use it as a measure of merit, but yet we don't actually understand its process.
And the first thing to understand is that any drug ever made probably was not FDA approved at the beginning,
Yeah,
right? Any drug has an experimental phase,
of course.
and any therapy also has an experimental phase.
Right.
So I think that has to do with it because the FDA tries to give by the way, I have been investigated 3 times by the FDA.
Really?
Yeah, I don't think any of the clinic in here in this area has been investigated so much.
Really?
Yeah, why? And I'm the only one doing all this alternative therapy.
And I will also mention to everyone who's listening and watching that also Alberto has been highly recommended to me by a number of horsemen and horsewomen that I highly respect.
Thank you.
So it's important to also mention that
Yes.
important information.
Thank you. And I don't see it as a bad thing being investigated by the FDA. First, we pass with flying colors.
Yeah.
Every time. Like absolutely nothing. Because we have been well educated on obviously how to do our therapies. Plus we're doing good for the horse.
Yeah.
Anyway, I digress.
Well, you've done good for my horses. That's what I can say.
Thank you. So we go on and we have this experimental drug, and the FDA, I think, has done a really good job marketing a safety, sort of like a safety window for the American public.
Yeah, and that's a good thing.
Which is a good.
We have
right.
credit that having safety protocols in place for pharmaceutical drugs that go to market is vital for general health.
Yep. And then you asked earlier, what does it take to do FDA approved? And I have participated in multiple FDA studies, so I can tell you with confidence. The first thing it takes is a population. And they're very good studies, extremely good studies. Very difficult. In the horse world, very difficult because of the caseload situation.
Right.
We don't have as many caseload as humans. Like for a study in a human, you can easily get 1,000 person.
Right.
But in a study in horses, to get 1,000 horses is very difficult. So the number is much less. And they have to be a really good study, have to be double-blinded control. So that means that there are multiple investigators.
Okay.
Multiple treatment modalities that are given without the investigator know what they are.
Okay.
And they have to prove that there is an unbiased improvement. That improvement needs to be absolutely unequivocally
apparent.
And that's 51%. So more than half.
Okay.
Right. So they're really good studies. To give credit to the FDA, they're really good studies. And if a drug passes a FDA study, they went into a ridiculous investment. I mean, millions and millions of dollars.
Wow.
Which no one that produces ozone has that kind of money. to get an FDA study on it.
Right.
So what's the only
that sounds
way?
like a huge barrier to entry.
Exactly. What's the only way to get a huge amount of to get that much money if you have funding?
Yes.
And
where does that funding come from?
From the pharmaceuticals.
Right.
So it all goes linked to the pharmaceutical thing. But we're making great strides, okay? We're making great strides. Back in the days, chiropractic was not well accepted either.
Osteopathy.
Osteopathy
was like wizardry, like witchery. People.
acupuncture,
Yeah.
even massage therapy. So we're making great strides because of people like you bringing this to be known. Because
Well, and I think it's about education.
yes,
Again, we as a platform believe deeply that the more educated you are, the more empowered you are. The more empowered you are, the more able you are to make decisions that are in the best interest of you and in our industry's case, your horse.
yes,
Because at the end of the day, it's a very every case. Yes, there are statistics and yes, there are averages, but you have to be able to make decisions that are best for the individual.
yes,
You know.
yes, absolutely, 100% agree. So back to the what is ozone?
Yeah, what is everyone's going? Okay, what is ozone?
So it's exactly what it sounds like. When you're in school and you study about the ozone layer on the planet.
Yeah.
So that is ozone. It's O3. Oxygen has. If you draw the oxygen symbol, is O2,
Okay.
and then ozone is O3.
Okay.
That's exactly what it is, and it's made by a machine feeding oxygen. I'm not gonna go back into the chemistry part of it. I'm just gonna tell you the basics of it.
Okay.
So imagine this is a machine.
Mm-hmm.
You put oxygen in this machine.
Mm-hmm.
There is a reaction inside, and what comes out
Is O3.
is ozone.
Is
O3,
O3.
which is the same thing, right? So that's how we produce ozone. For your audience that is extremely chemically inclined, they can easily Google and figure out what the reaction is with it uses UV light, etc.
Cool.
And then the person who find this was obviously a genius, and I'm not sure who it was, because you take that and you put it in the human body.
Yeah.
And
or the horse's body.
Or the joints.
Yeah.
And it has a great anti-inflammatory effect. One, if you put it in the bloodstream, it has actually a great oxygenation effect in the red blood cells as well. And it has great effect in the immune system as well. It has great antibacterial effect. And now some hospitals are using ozone to disinfect the surgical suites and instruments and all that. So ozone is a great disinfectant as well.
And does that mean it's good for parasites?
And I'm not sure if there's any research at this moment on parasite, but there's plenty of research on bacteria. And so it kills bacteria.
Amazing.
So if now people ask me, wait a minute, we use it to disinfect, but we also use Clorox to disinfect and chlorine and all that. So you mean is it harmful? I said, no, it's not. It's not one of those disinfectants that you're thinking that kills everything. It doesn't. It kills bacteria. Some bacteria do not do well in ozone, which is good for us.
Yeah.
It improves oxygenation of the blood.
Yeah.
It decreases inflammation in the cells and also in the joints.
Yeah.
Actually, I have done it. I have used it myself on multiple areas, and I can attest to that myself.
Yeah. And so when you give it to horses, could we maybe share with our listeners and with the audience a little bit about what does administration look like?
Okay, perfect. There are multiple ways to administer, and when you Google it, because I know after this there's a huge influx in Google about ozone.
Yeah.
There's so many ways to administer it.
Cool.
One of them is in the vein, intravenously.
Yeah.
In the vein, it can go two ways. In people, they advocate against doing it directly in the vein. However, I have done over 3,000, maybe 3,300 ozone treatments in vein so far, directly in the vein. and we have not had the reaction that 1 in 1,000 or 1 in 2,000 people get. So we never seen a side effect of it, other than the occasionally, probably like 2 horses had a little bit of extra sweat.
Okay. Yeah.
So that goes in the vein. Good. You could put it in the joint, which is literally you get, remember the oxygen machine,
Yeah.
get the ozone in a syringe.
Yeah.
From that syringe, go straight in the joint.
Yeah, and I've watched this now a number of times. So to give everyone like a bit of a picture, they're taking a very large syringe, kind of similar to like what you would give, like it's bigger even than the syringe of what you would give like a dewormer or whatever. It's like quite a large cylinder, and it's filled with air.
With ozone.
With ozone.
No air.
No, but like to the uneducated eye, it looks like air. It's not air, it's O3.
Yes.
But it's essentially like a clear cylinder, and they administer anywhere from like 3 to 4 to 5 to however many that horse needs.
Yes.
And then you can do, and the protocol is different for different horses for different scenarios.
Yes.
But they're giving it intravenously.
Intravenously in the joint. It can be done intravaginally for reproduction purposes.
Yeah.
And it can be done per rectum as well.
Okay.
And it can be bagged. You could put a bag around the area, around the wound, and do what we call ozone bagging. Fill out the area with ozone and let it sit.
Oh, wow. That I have not heard of.
Yes, let me see if I have a picture over here.
Well, and we'll be sure to include...
So
I'll include links to this book.
Yes, for those of you who want to know, you can go to albertorullan.com. Yeah. albertorullan.com and go to the ebook link, and you can see it.
You'll see regenerative therapies, and all that we're talking about today will be available in the show notes on that link for Alberto's book.
Awesome.
Yeah.
Awesome. So that's ozone. Is so simple.
It's very cool.
So simple.
Okay, so then next up in your book, you talk about the hyperbaric oxygen therapy.
Yes.
Okay, so that's hyperbaric chamber.
Yes.
And so I didn't know that you could actually you could walk a horse into a hyperbaric chamber.
Yes.
So first of all, I don't know about anybody else listening or watching, but I didn't know that that was actually a thing.
It's an amazing therapy. It's a therapy that this one has a little bit more research. Why? Because the armed forces like it.
Oh.
Yeah, the armed forces got involved in it. About maybe 5-6 years ago, they invited me to speak at the National Hyperbaric Convention because they wanted to see, okay, what are we doing in horses?
Yeah.
Because they love learning from us.
Yeah.
We do so many cool things, right?
Really?
Oh yeah. The open-minded, well-educated human doctors, they love contributing with us. They love collaborating with us.
Oh, that's really cool.
Yes.
And interesting.
There are not that many of them, but they do.
Yeah.
But actually, I believe, and I'm willing to say that at the forefront in hyperbaric oxygen chamber, the armed forces are at the forefront of this. We are not.
Wow.
It's not like the stem cells where I believe that we are.
Yeah.
So what they did is they did a study, and it was so powerful. They did multiple studies. One of them proved that the stem cell release from the bone marrow, which is where most of the stem cells in the human or animal mammals, is in the bone marrow.
Yes.
Inside the bone.
That's how they got my stem cells, was out of my bone marrow. Yeah.
So the hyperbaric chamber promotes 100% more release from the bone marrow.
Whoa.
Yes. There was a study done in 2006 in Pennsylvania that proved that 100% more. So that's the first thing that cannot be argued with, right?
Yeah.
Okay. Then the armed forces did this awesome study on soldiers with PTSD. Particular soldiers that had some sort of bomb or explosion next to them and somehow traumatized the brain. And that trauma was actually noticed on MRI.
Oh, wow.
So then what they did was very clever. They did 30 to 40 treatments, and the patients, the soldiers, would go home. And what was most impactful of this is what the wife and family members reported. Not what the patients reported, but what the family members reported. And this is not powerful. You tell me what it is. Because they brought a panel of wives and family members saying how much have this changed.
Observation.
All the observations that they saw on the soldiers that had before and after the hyperbaric
Really?
oxygen. It was amazing.
I'm even thinking, as you're speaking, I'm thinking of there are so many people in the horse world who have had major concussions,
Yep.
like who even have stopped. Like I've been even in the colt starting, like I'm even thinking in the colt starting community, how many cowboys have had so many concussions that they've been told,
Yeah.
like, you can't do this anymore
Yes.
because we can't guarantee that you won't have like a life-altering concussion next time.
So
This could be huge for them.
it's huge. Welcome to Epic.
Hey everyone, it's Noelle. While we were in Ocala, Florida, my horses and I worked with Dr. Alberto Rullan and his incredible team at Epic, the Equine Performance and Innovation Center. Lady and Galana warmed up on the Eurosizer, worked the aqua treadmill, and healed in the hyperbaric chamber. They tailored a program to each horse's specific needs, helping us navigate health challenges and build strength and conditioning. Lady and Galano loved swimming laps in the world-class outdoor pool. Epic truly has something for every kind of horse. Thank you, Dr. Rullan and the Epic team for keeping my horses in top form during our travels. This could be huge for them.
It's huge. So after I went to that conference 5-6 years ago, and I showed my cases, and they were like, "Wow, those are great cases." I said, "Yeah, but what you guys are showing is just amazing, because now we can help so much our patients, our horses, and with confidence we can say that." So, needless to say, in the veterinary community, extremely looked down upon, because they only think, because we have done a very poor job at doing that, providing that research that the armed forces have done.
Right. But the armed forces are able to use government funding to research it.
Thank you.
And of course, and also I would say, because PTSD is it's a societal pain point.
Yes.
You know, it's affecting people from all socioeconomic backgrounds, that they're going to be able to justify funding from from government taxes to fund that. Whereas I would imagine it would be very difficult to find funding to do research on hyperbaric chambers for horses.
Yep. So we have to do it. We just have to report the findings that we have, and we have done amazing. And there's a webpage I created called equinehyperbaric.com.
Cool.
Equinehyperbaric.com, where I post the most dramatic cases. And that is kind of our own way to show the public what we can do.
So what would be an example of a reason why I would put a horse in a hyperbaric chamber?
So the first and most common example, and the widely accepted, is for wound care.
Okay.
Let me tell you, it improved the wound healing significantly. And we have control studies where we show 50 to 60% improvement. So
in what kind of period of time?
Let's say you have difficult wound care. The most difficult wound care that I feel in horses is in the legs, where they have a cannon bone exposed.
Yes.
Right? That happened. They put the leg in the cannon bone.
Yeah.
I mean, in the fence.
Yeah.
And they do what's called a deglobing injury.
Yeah.
Those could take a year or 2 years
To heal.
And we have
And not to mention the length of time, what the mental and emotional impact on that horse is to be completely confined during that time.
It is a huge drain, physically, economically, psychologically.
Yeah.
And we have been able to prove that we can shorten it up.
Wow.
To 6 months.
Wow.
Or more. We actually had a patient, we were able to get it out at 60 days. Now, this is with very utilizing what I just told you. Why? Because one, the hyperbaric oxygen chamber increases the stem cells.
Yes.
So you now have a lot of soldiers feeling those wounds, right? But in addition to that, if you think about a large wound, in the center of that wound, there's no much blood flow. There's no blood flow, period.
Of course. Well, there's a break. There's a fracture in the skin, in the nerves, in the tissue.
And what brings nutrients and oxygen to a wound is the blood vessels. So oxygen now is pressurized in the body, dissolve in the plasma. We're talking about 600% more oxygen dissolved in the plasma after the hyperbaric chamber. 600%. So now we all know that oxygen can help all those cells reproduce and fill in faster.
So again, this is coming back to helping the body do what it does already, but do it better.
Exactly.
Like do it like it's like they're like superhuman.
Yep, exactly.
Mm.
So all the things that we have done, that's the most commonly accepted. That one is undeniable, 100% undeniable. And what is really interesting is that we have been using it for lung and respiratory issues as well,
Oh, cool.
with great results. Great results. Yes, not FDA approved. Again, right? So it's looked a little bit frowned upon by the community, but we have been able to do some amazing treatments on respiratory issues, pneumonias, really bad pneumonias that, when the horses are traveling for a long period of time and all of a sudden start developing abscesses and large amount of infection in the lungs, they have to be drained out. Excellent result. Now, I never promote do it on its own. We still go to surgery. We drain it. So I always use it in conjunction with our Western medicine. So the surgeon drains it, clear it up as much as he can, and then we put it in the chamber. Those horses recover way faster. Recently, I had a client that called me, not a client, a potential client, but he's been at a clinic for 3 months. This horse hasn't been able to breathe for 3 months.
Oh no.
More. What's October, November, December, February, and now it's going to be 4 months. Can you imagine not breathing for 4 months because your doctors don't believe that there's a therapy that can help you, but there is a therapy that can help you?
Well, it makes me think, because I think it's important even to go down to the basics. So when let's say there's a lung infection.
Yeah.
And I actually have a really close friend, and I can't wait to send her this podcast because she has had a terrible time with her mare and asthma. And so
that's a tough one.
Yeah. And she lives in she lives in the Pacific Northwest. So it's a very moist ecosystem. It's a very, it's wet, it's cold, it's, And so she was given all sorts of different protocols with steroids.
Yes.
Right. And anyone who's listening who's had asthma knows that if you've been given ventopulmin or you've been given different things. So steroids are here, and you're going to explain this better than me, but I understand that steroids are like a retardant. They're they're a suppressant.
Suppress the immune system.
Okay.
100%.
And we do that because why? Why do we give? So if you're suffering from something in your body, either as a horse or as a human, why do we give something that actually suppresses the immune system?
Good question. Great question. And there's actually a science for it. Sometimes the immune system gets a little bit out of control. And we have to tell the immune system, hey, hold on.
Calm down.
We got it.
Okay.
So a lot of time the steroid, that's what they're doing. Calm down. Quit bringing 10 million soldiers to the battleground because you're killing us.
Yeah.
Rather than we just need 10. We just need 10 soldiers for this battle. So that is where the immune system where the steroids have a good place. That's why when we treat a horse like that, that is in respiratory distress, we do not discontinue the steroids at the moment.
Okay.
Our goal is to find a middle ground of where the horse can live happy and healthy with less steroids. We play to see what is the least amount of steroids that we can have.
Understood.
With our therapies. Try to give the body then the proper immune reaction, right? Because we still need sometimes we still need the steroids. But it is our experience that many times we can take them off. We can take them off the steroids if we continue using regenerative or alternative therapy. There's so many out there that you can do inhalant. You can do inhalant with stem cells. You can do inhalant with amnion therapy, which is also in the book. You can do inhalant with alpha-2M. And while doing that, you can put them in the hyperbaric oxygen chamber too to increase the efficacy of the immune system.
So you could actually do Could you do steroids, and would you do like steroid treatment or antibiotic treatment in conjunction
Yeah.
with the hyperbaric chamber?
Absolutely. As a matter of fact, if you see some of my education and podcasts on the hyperbaric chamber on equinehyperbaric.com, you will see that one of the effects of the hyperbaric is actually potentiates the antibiotics. It helps the antibiotics. We had a case, one of our most famous case was a horse that had a navicular bursa infection from a nail that went on the withers. She jumped. After the jump, the shoe came off. Somehow the shoe got twisted and went back
Oh, wow.
into the foot, into the navicular bone.
Yeah.
That created a really bad infection.
Yeah.
The horse went to surgery, number 1.
Yeah.
And after surgery came out 4 out of 5 or 5 out of 5, meaning not weight wearing.
Wow.
Couldn't bear any weight. Went to surgery number 2.
Yeah.
And came out the same. Went to surgery number 3 and came out the same. The owner was a helicopter pilot for the army. So she started Googling and she found us. She said, would you do hyperbaric on my mare? I said, sounds like you went to the best of the best clinics in town and they couldn't fix it. I don't think I could fix it. She's like, I don't care. I need you to fix it. Call somebody. She wouldn't take no for an answer. I said, we've never done this before. I don't know if it can be done. But she has so much perseverance that I started calling, and I ended up calling a great friend of mine now. Her name is Chelina. And she was like, well, it's going to sound tough. But if I was you, I would do this and this and that. And she gave me a protocol for it. I called the owner and said, hey, I found somebody that told me we might be able to help you.
Yeah.
We changed nothing on that horse. We kept the same antibiotics that she came with.
Yeah.
The same anti-inflammatory. We changed absolutely nothing. Her name is Willow, and you can see it at equinehyperbaric.com. That horse actually recovered very well, and they were able to get embryos out of her.
Oh, wow.
This mare while she was with us, they got embryos out of her.
No way.
Yeah. So
when you're doing and this is what I think is important to mention, is that you're not, these regenerative therapies, you're not saying don't do the antibiotic, don't do steroids, don't follow these Western medicine practices.
We have to
do it in conjunction. With evidence that they actually improve the efficacy of the protocol being given.
100%.
Which is really exciting.
Yes.
Because I think every horse person who has had a horse that is being treated for whatever physical ailment that they're dealing with, any chance that you can increase the efficacy of the protocol that you're spending a ton of time, money, and emotional grievance, like emotional energy on, I think you take it.
You just mentioned something interesting, and I just can't wonder. We save our clients a lot of money. It seems expensive at the beginning.
Yeah.
But when they come back to me, they're like, holy crap, I wish I knew about this 4 months ago.
Yeah.
Because if you think about being on an expensive antibiotic for 5 months, let's say you spend $100 a day, which is very little compared to some of these horses. $100 a day.
Yeah. And that's a lot. Like
for 5 months.
Yeah.
That adds up pretty fast.
Yeah, it does.
Just on antibiotics.
Yeah.
Add to that the care and everything else.
Yeah.
Actually, a price about $120. So over $120 a day, over 5 months. And then I tell them, hey, if you would have come to me, maybe in 3 months, we would have got you out, or maybe in 2 months. So the mathematics is actually very favorable because we still want to do the antibiotics. We want to do everything else. We just accelerate the process.
Well, and I'm glad you mentioned cost, because when we talk a lot about these therapies, I worry that a lot of our listeners are going to go, yeah, that sounds nice, but that sounds expensive. That sounds like for the 1 to 5% of the horse industry you can afford to have a horse, and I mean, I will admit, imagining walking my horse into a hyperbaric chamber sounds expensive.
Well, let's talk about the economics. Let's be, and you probably know about this more than me. Well, let's say the average boarding and training you do. What would be the average boarding, training, and care for a horse in a month?
So I think the average
I know it will vary.
So the average spend of an equestrian annually for everything is $7,986 a year. That's the average spend per year on everything.
7 or 70?
7.
7.
It seems low.
Spend on, but that doesn't include training.
No, that doesn't. No, that's because not everyone spends money on training.
Last time I checked on some of my clients doing a pool.
Yeah.
They were between 7 total cost per horse between 65 and 95,000 per year.
Per year, yeah. And I've seen that too. And I think that number is indicative of this more sport focused subsection of the industry. Yeah.
Which is most of the horses that we're talking about that we treat are sports horses.
Correct.
Right?
Yeah, totally.
Now, what is the cost of not having that horse trained for 6 months? Think about this. Think about what does it cost to have a horse then stop. Because now what this owner and trainer have to do is they have to replace the horse. They have to replace the activities. So that we can measure that cost. How about the psychological effect of the athlete, trainer, not being able to compete? Because for those of us who know competition, there's a psychological aspect of it.
Totally.
Right?
Yeah.
So now you start compounding cost of the horses not being fixed. The stress of having a sick horse.
Yeah.
The price of trying to replace that horse. That piles up very quickly. But what if we can then, let me give you a quick example. At this moment, what day is today? January 30, 2025.
Yeah.
To do a horse out of clinic at 21 days with a treatment of 10 hyperbaric, the very basic is about $4,810.
For how many days?
$5,810.
5,000
21 days.
for 21 days.
21 days, right?
So that averages out to shy of $250 a day.
So let's round it up to $250, $275 a day on the hyperbaric, right? On the high end, let's say the horse needs a lot more treatment. Those 21 days become 7,300.
Okay.
Roughly.
Yeah.
Right. So now, if you think about 7,300, 21 days, almost a month, versus a horse in training.
Yeah.
That I just told you, a 12-month period between 65 and 80, 90,000.
Yeah, totally.
It's not that much.
Yeah. Well, if you think about so when people spend, I think it'd be very common to many of our listeners that you're going to spend between $2,000 and $5,000 on training and board and feed, right? And then if you have those costs already, but then you're missing, but if you have to increase the length of time that the horse is out of commission or not able to compete or not able to be even healthy, like the compounding effect is significant.
So
it's like what you're talking about is paying more in the short term to have a longer term return.
Because my point is the cost per year of a sick horse is outweighs, is way more than getting that horse healthier in a shorter period of time. I have done the calculations many, many times, and it always points to the same. Treat early, be aggressive early, and avoid a 5-month, 6-month problem, especially in this case with pneumonia or wound, for example.
Yeah.
We have some wounds that have taken a horse out of commission for a whole year because of the whatever resistance we get to treat them,
And that sounds like really good advice, right? To our listeners is be aggressive early.
Yes.
And don't be afraid to be proactive.
Rather than wait and see what happens. Because let's say, I don't know, I'm a father. I have a 13-year-old and I have an 11-year-old, soon 14, soon 13 and 14 and 12. And if I go to the doctor and the doctor tells me, yeah, he has a fever now, let's wait and see what happens. I don't like that.
Yeah.
I don't like
that either, yeah.
He has a fever now, let's wait 5 more days, which is very common. I'm telling you a real case, right? A real case. My son got a fever. We took him to a doctor and the doctor say, don't do any treatments. Let's wait and see what happens. Yes, a lot of times it will resolve because the immune system will resolve on its own. Hey, but what if the doctor tells me, hey, but if we are proactive and we can do some alternative therapies, instead of waiting and see what happens in 10 days, we could probably shorten this up by 5 days.
Yeah.
How cool would that be?
That would be, yeah. Because again, what I'm seeing as a theme is these regenerative therapies are helping the immune system do what it's already designed to do, just do it better.
Yes, exactly.
Because something that I think is really important that I've noticed in a lot of the conversations I've had about ozone is we and our horses are exposed to much more toxins, much more pollutants, much less affected, like much clean. We have a lot more GMOs in our food.
Herbicides.
Yeah, herbicides. Like I have my horses on like a supplement that actually is counteracting Roundup.
Oh, great.
Because I had a holistic vet say, I think one of your horses has been exposed to Roundup, which, and also that since then, I've talked to many professionals that said all of our horses have been exposed to Roundup, right?
Yeah.
So it makes me think that, if someone's listening, and I thought this too, I thought, well, if our immune system is great, why fiddle with it? Why mess with it? But I would say that our immune systems and our horses' immune systems are much more, and you can let me know what you think about this statement, but I feel like we are fighting a much harder battle than 100 years ago because there's a lot more in the air, in the water, in the food than there was before.
There's no one would argue with that. Absolutely. No one will argue with that.
So it's not too far afield to say that we could use some help where we can get it.
Right?
Right.
Exactly.
So let's talk about stem cell. I'd love to talk about, and maybe we can talk about it together, like stem cell therapy, PRP, which is equine platelet-rich plasma, which a lot of us, I think a lot of us are familiar with PRP, but I'd like to talk about it in detail. And then the amniotic fluid, AMP. Oh man, this is interesting stuff.
So let's go with the stem cells too, because the stem cells have a lot of intricacies and controversies on its own. Back in the days, we used to think that you had a problem, you had a wound, you're missing an organ, you're missing a tendon, you're missing a ligament, and we used to think that we were going to put a stem cells and it was just going to create a brand new one, right? It doesn't.
It doesn't work
like that. Okay. We have found out that the stem cells themselves, and this is part of the, I don't want to say problem, but this is part of the challenges that we have found. The more research we do, we keep finding out that there are different ways they work. Not that they're ineffective, it's just that there are different ways they work. And we have found out that the stem cells doesn't necessarily regenerate a tissue. And that's why now they're trying to change this. Instead of doing regenerative therapies, there is a big movement to call them orthobiologics. Ortho from orthopedics.
Yeah.
Biologics from biologics.
Cool.
Rather than calling it regenerative, so that we don't get confused and the public doesn't get confused and thinking, yeah, you're going to chop off your thumb, you put stem cells and grow a new thumb.
Well, I think language, and that's where word choice is important.
Yes.
Right.
Yes. So now we call it orthobiologics because we found out that they don't regenerate that tendon. But what they do is they, one, have anti-inflammatory properties on its own.
Yeah.
And two, they call the stem cells from the body, they call them and say, hey, let's repair this. So let's repair this together, repair it faster. And then they get to work.
And it's cool because you call them soldiers, and that's how they was described when I had stem cells done. That's how the doctor explained it to me.
Yes.
He said, we're gonna go in, we're gonna irritate that ACL that has torn, and we're gonna tell the body, hey, it's like a big white flag.
Yes.
Like, hey, over here. Then we're gonna draw your bone marrow. We're gonna spin it and draw your stem cells, and then we're gonna, with these huge needles, huge. Good thing I didn't have any issue with needles. With these huge needles, we're gonna very specifically target the stem cells to this area, and that stem cell, they're all like little soldiers, and they're like kind of like super motivated, like the super motivated sergeants going, "Hey guys, like come over here,
fix this.
We gotta fix this, and like right now."
Yeah. That's it. And that's how it works. That's how we have found out that they work. Now, same thing with amnion. What is amnion? Amnion is fluid let's say you have a foal,
Mhm.
and this foal comes in a bag.
Yeah.
We call it the placenta.
Yeah.
And this placenta has a part called the amnion. And the amnion, AMNION,
Mhm.
that amnion goes around the baby itself.
Oh,
So it's another layer.
it's like the amniotic fluid.
Yes.
Yeah.
And that amniotic fluid can be collected.
Oh, wow.
And the amniotic fluid has great anti-inflammatory properties. Great.
Yeah.
And that can be put into the bones, into the ligaments, into the joints.
And so for everyone to know, that's also what we're going to be doing today with my mare.
Yes.
We're going to be putting, so I have been working with Alberto to work on my mare and some of her previous injuries from her previous life to reduce the inflammation and create more basically more support in areas that have bone spurs
Yes.
or mild kissing spine.
Yep.
And we've used amniotic fluid in those areas, correct?
Yep. We do amniotic fluid, and we also did it in her eye because she had uveitis.
Uveitis, yeah.
Ooh, someone's not gonna like this, but
Yeah.
we did it in her eye.
Yeah.
And we also do alpha 2M, which is another blood product.
Yes.
Alpha 2M is a plasma product
Yeah.
that has the particular protein called alpha 2M
Mm-hmm.
that's in our blood.
Yeah.
We concentrate it, we spin it,
Yeah.
concentrate it, and put it in the affected area.
And I want to share with everyone who's listening or watching that the reason why I can share with everyone my reasoning was that my mare is 15 years old. She's had a big and colorful, exciting life before me. She's clearly had a series of injuries that weren't treated at the time. So what I'm trying to do is we're trying to see if we can use these treatments to improve her comfort level and allow her to regain a closer to 100% mobility in those areas instead of the last, which I always think is, and it's a really important one to do, is the point of the last point of contact, I would say, or the treatment is steroids.
Instead of steroids.
And there's nothing, and you told me when we talked about this, there's nothing wrong with steroids, but wouldn't it be cool if plasma and amniotic, A2M and PRP would work as well with her, because we can continue to give that over time. Steroids have a bit of a different effect over time.
Steroids are not going to heal, but they're great anti-inflammatory. Right. They're amazing at what they do. It's a great discovery. They just don't heal. You get a steroid shot in your knee, you're probably going to need another one in 4 months, 3 months after your ACL.
Yeah.
It doesn't last a whole lot of time, and it will help you with the pain. It will help with the inflammation.
It's like more like it's like a super powerful Band-Aid.
Yes, that's I like that. It's a super powerful Band-Aid. Yeah.
Whereas PRP and A2M, what would you call them? They're more
they're also a Band-Aid.
Yeah.
But they help fixing. But they're also a Band-Aid.
Yeah.
We still have not come up with something that completely reverse the process.
Yeah.
Now, bear in mind, haven't we come up with this because we don't change our pattern or we don't change our behavior? Because think about the simplest thing. Think about you go to a chiropractor. The chiropractor adjusts your neck, your back, and you feel really good.
Yes.
Now you go home. Did you change your bed? Did you change your car seat? Did you change the way you walk? Did you change your shoes?
So true.
Right?
Whoa.
So are we not seeing the full effect because we continue doing the same thing, or just because they don't actually reverse it? There's a question to pose out there that might be interesting looking into the future,
Gosh, that's such a, I feel like I'm going to give that.
Yeah, right.
Okay, so I think that's such an important point, because that's the importance of podiatry and why our understanding of our horse's feet, they say no hoof, no horse, right? The nutrition aspect of things. Are our horses actually being given the very best chance they can to develop the muscles and the strength that they need to? Top line physiology, biomechanics. So all these things, you're so right, Alberto. Like we can go and get fixed by the chiropractor, but if we are still sleeping on a really poorly designed bed and we're still spending 15 hours in front of the computer with our neck forward like this, right? if we are slunched over, we're not doing any physical fitness, we're not strengthening all the parts of our muscles and our bodies that we need to have correct posture, then it doesn't matter how great your chiropractor is.
Yeah, we can easily tell it didn't work, or we can just say, hey, I didn't do anything to make it work, or I just have to keep going, right? You keep going and not change anything else.
And that's why you told me the first round we did of injections on Lady, you said it's really important that you maintain and you continue to work on her physiotherapy.
Yes.
And that's something that, and I've come to really understand, like we talk a lot about core strength in people, but do we talk a lot about core strength in horses?
It's becoming more and more accepted and more popular now because the human physiotherapists are doing a real good job helping us understand that. And then the us as trainers and rehabbers, now we're okay, it makes a little bit of sense. So we're working towards it as well.
Because I can imagine, like, if you bring someone in and their horse, and you say, okay, look, hey, this is we caught this early. We can do a series of PRP and A2M injections. Amazing. This is not too bad. This kissing spine is not too bad. But if that owner goes home and overfeeds the horse, right, and that horse is actually really high on the body score, like on the body score spectrum,
A 9.
Yeah, 9, and the horse is obese, then the stress on that skeletal structure is going to counterbalance all the money that they just spent with you.
Or it doesn't change the training. For example, a kissing spine horse shouldn't be trotting a lot. That horse should be doing a little bit more cantering and gallops than trotting, just the way the rehabilitation works. They go back to trotting with a person banging on their back. It doesn't last that long.
And why is that? Why? To explain, I think that's actually a really good thing to mention to those who are listening.
So now we're going to talk about rehab.
Well, let's dive in a little bit.
Okay.
Like, I mean, we'll stay on point, but I think that's a really interesting one because I'm sure everyone I remember that you mentioned that to me first and I was like, wait, what? More canter and more walk and less trot?
Yeah, if you have a kissing spine, side note for the podcast, if you have kissing spine, you want to, and how do you engage the core more? What is the core? And the core has your abdominal muscles are a big part of your core, right? So if you look at your horse when it's cantering, those abs are very engaged. And if you look at the horse when it's trotting, they're not. So the horse trots, and I'm going to try to verbally tell you what happens. There's a big blob of food in the belly called the intestines.
Oh, yeah, of course.
A big bag of food in there.
Big bag.
Right? It has hundreds of pounds of food.
Yeah.
Stomach, small intestine.
Yeah, it's a lot of weight.
We call that the viscera. And when that horse trots, when it elevates and down, that viscera is actually moving up and down too. Right? And if the abs are not engaged, it will pull down. And it will push up.
Gotcha.
And the spine, pull down, push up. Versus in the canter, those abs are really tight. And the viscera, all that hundreds of pounds of food are compressed in there, are tight. And then there's less bad motion in the spine.
Cool. I think that's really helpful because there's more and more cases of kissing spine. And I always wonder whether that's because there's more cases of it or
we're seeing it.
We're just seeing it.
Yeah,
right?
We're probably seeing it more.
It's very interesting. But I know that was a real wow moment for me as I'm working on the biomechanical and foundational aspects of my mare as she's going through this work with you. So to wrap up, I thought it would be really cool to talk a little bit and just kind of close out on shockwave therapy.
Shockwave that has become very, very common in the equine athletes. They have done a fantastic job at marketing it and promoting the use of it. The companies that provide shockwave, I believe that have done a very good job explaining and researching the product, right? Some of the myths that I like to always uncover myth, right? It's not the same as TENS unit, the one that you buy in the grocery store or in Publix, and then you put it in the skin and give you electricity.
Right. Okay.
So that's not shockwave.
That's not shockwave.
No. And it's not the same thing as what we call PEMF, pulse electromagnetic field therapy.
Yeah. And so that would be like that's like MagnaWave.
MagnaWave and Emer. So shockwave is not that.
Okay.
Right? Shockwave is more of a it has more of a sound wave actually that goes in the tissue, penetrates the tissue, and we have found out that it has some improvement in the circulation. Definitely has improvement in the pain, and it has some sort of anti-inflammatory effect.
Okay.
When I broke my fibula, probably about 8 years ago,
Okay.
I actually shockwave it because it was so painful. It was so painful, and I needed to keep working. As a young veterinarian back in the days, you cannot skip a day, so you have to keep going and have to heal it faster.
Yeah.
So what I did, which is probably not a recommended by the orthopedic surgeon, but I can tell you that my pain was significantly decreased, and it healed very fast. It really helped heal. This was invented for people.
Oh, cool.
The problem is it's so painful.
Shockwave is
It's
painful.
so painful on people, yes.
Oh.
So it does causes pain, and they're coming up with some of them now that are quote unquote less painful.
Yeah.
But it does hurt when it's
So does that mean when you do
friction.
shockwave on horses, it hurts?
We sedate them.
Oh.
Yeah, we sedate them.
Why does it hurt?
Well, because that massive sound wave going, it's like a shock. It's literally a shock of sound wave that go in, and that produces pain, especially if there is a irritated tissue. Because if there's irritated tissue, it's already highly sensitive.
So how does that heal anything?
Yeah, it's very interesting. I don't want to get into the deep aspect of the science of it, but let's say it goes into the cell and it helps the cell produce more signals, produce more chemicals that are actually good for the
So
body.
it's like almost like intentional stress on the area.
Yes.
Well, because we always use, whenever I think of pressure, people go, "Oh no, not too much pressure, not too much pressure." But I'm like, well, actually, if you think about it geologically, what creates a diamond?
Pressure in the charcoal.
Yeah. So there's lots of incidences in nature of how pressure, if intentionally focused, actually produces something remarkable, something cherished.
Perfectly.
Right? So it sounds a little bit like intentional stress or pressure to produce like a result within the body biochemistry.
Excellent explanation. That's right.
You can hire me anytime.
Couldn't do it any better. I'm gonna take this piece for sure.
Man, I have learned so much in this podcast.
Awesome. I'm glad.
I am so well, and I just want to say, like, I've been really grateful to be introduced to you, to work with you, and to learn from you.
Thank you.
Because I think it's so important that as everyday horse owners, we're given the tools to make the best decisions for our horse's health, because our horses can't speak for themselves. So I think it is truly fundamentally our responsibility to learn as much as we can about what's available, and then what's available each within our own, like what's available in our area.
Yeah.
As soon as we started doing A2M and PRP, I said to you, well, do you think it's going to be available? And I did some research. Is it going to be available in my area when we go back to the Pacific Northwest? And sure enough, it is.
It's becoming more widely available, and because of owners like you and promoters like you, now who are so concerned about the health and welfare of the horse, it's starting to get more known, because we vets, we do a horrible job promoting these alternative therapies. We do a really bad job because they're not drugs.
Yeah.
Right? So it takes a massive effort on the horse trainers, owners demanding it.
Yeah, and I was going to say, it's just horse health is as much a market as anything else, right? So the market will respond to the demand. Supply will respond to the demand. So for everyone who's listening or watching this episode, if you are in an area that these therapies don't exist, I think that every individual has the ability to band together with other individuals who want it, and to start actually calling out, to reaching out to your local vet clinics and saying, we want this.
100%.
Because again, every vet clinic is just like every business. If the market demands it, they will inevitably respond, because it's what the customer wants.
100%. One of the biggest fears of veterinarians is to spend several $1,000s on a product and expire on a shelf,
Oh, yeah.
right?
Yeah.
Because in order to do a lot of these things, you have to do quite an investment.
Yeah.
You basically need to have a laboratory in your place, and you have to invest thousands of dollars. So that's a big fear.
Yeah.
And I know, because I know many veterinarians who don't have the equipment. They just send me the horses. No, you do it, right? You go and do it. But they're good enough to recognize that they don't have it, and they want what's best for the horse.
Cool.
So they'll send it to us. They do everything else, and then we'll do the therapies. And that is, if there's a demand, the vet will get it. I promise.
That's what a great way to wrap up the podcast.
Awesome.
Thank you so much, Alberto.
You're very welcome. It's been an absolute pleasure. I hope I added value to you and your audience.
Yeah.
And we are here for you.